2316 final project. So going through our table of contents, we're going to address what the project is about, the purpose and why we're interested in researching this topic, our data collection process and how we found these data sets, as well as cleaning the data, which we did in phase 2, data analysis, insights, and visuals we created during phase 3, and overall conclusions that we drew from this analysis.
The purpose of our project was to analyze COVID-19 in countries worldwide during its peak in 2021 and determine the relationships between a country's healthcare system and the impact COVID-19 had there. Additionally, we aim to discover if certain regions of the world are more effective than others in treatment of COVID-19.
Some points of interest of why we decided to research this topic were that we both witnessed firsthand the impact of COVID-19 on our families, as we both had relatives and family members who got sick from the virus, as well as during our current study abroad in Metz, France this summer, we have observed significant differences in healthcare systems between the US and France. In France, it's more accessible and affordable to go to the doctor compared to the US, as it is the fraction of the cost here. And as a result, this contrast has piqued our interest in how these differing healthcare systems could have managed COVID-19 pandemic and the outcomes.
For our data collection process, our large downloaded data set was from World Bank. This data set contained a list of countries and their world development indicators, such as population growth, the survival rate of people up to an age, differences between men and women. And then our JSON formatted data was from disease.sh.com. This contained data of countries on their COVID-19 statistics, such as active cases and total deaths, and also like total test cases. And then our website that we used, Beautiful Soup to Web Scrape, was from Wikipedia regarding the percentage of the population where they were covered by insurance for each country.
So for our current downloaded data set, how we scraped it, how we cleaned it was that we dropped unnecessary columns that didn't have any data in it. We filtered through indicators that we wanted to and narrowed down to them focusing on country name, indicator name, and data for the years of COVID, which were 2020, 2021, and 2022. And the indicators we focused on were survival at age for both male and female, population growth, age dependency rate ratios for old and young people, as well as population ages 65 and above. And we removed a discrepancy of a row for our country column where the name was upper middle class, which is not a country name. And here's our output as we have our country names and the indicators as shown here with our years 2020, 2021, and 2022. And this is just a summary of the first 5 indicators of countries and the last indicators for Zimbabwe. And this is in alphabetical order.
For a data cleaning process for the web requirement 1, we sent a request to Wikipedia and created a beautiful soup object. This created an empty dictionary named or country. Then from there were some null % values. So we had to remove those null % values from the different statements on the insurance coverage. There were also some values that had a hyperlink shown as like a boxed in 7. So we had to remove that so then we could only pull out the insurance coverage and put that into our data set. To do that, we used regex and it ended up working out. And this is our output. As you can see, it shows each country in alphabetical order, and then next to it, the insurance coverage %. Yeah.
For data cleaning process, for web requirement number 2, we use the requests to parse the JSON into a Python data frame. Then we replaced the values of categories that contain 0, such as critical per million, with NaN values. And then we removed all columns as a result. After that, using the drop NaN function that contained NaN values, as they were not very useful for our project. And we masked the data frame to contain necessary columns such as country, total cases, total deaths, total recovered, active cases, critical cases, cases per million, deaths per million, total tests, tests per million, population, and continent. And this is our output as we have all countries listed as well as the columns that we wanted and the data that corresponds to each column.
For Insight 1, we looked at what countries have the highest and lowest survival rates to age 65 between males and females in 2021, which is the peak of COVID-19. And then we want to see, do these countries have significant difference in the survival rate between males and females? And do they have a significant difference in population standings? So we read the Excel, and then we pivot the data to focus on survival rates from only 2021. Then we find the countries with the maximum and minimum values for survival between the ages or up into the ages of 65 for both males and females. And then we construct and return a data frame that contains these values. And then in the bottom left, you can see the output where it shows the maximum, which is Monaco, and a very small difference between the survival rate of males and females, but females are still ahead. And then the minimum, which is Lesotho, Lesotho, which shows a much larger difference between the survival rate of males and females, with females still ahead, but it's about 12% difference this time.
Insight number two, our question was, is there any correlation between the countries and our clean data set based on population and death rate? Do countries with a higher population have higher death rates? So as what we did was we read their Excel, calculated a death rate by dividing total deaths by the population for each country, masked the data frame to contain the necessary columns of country total deaths, population, and death rate. Data stored is then sorted by the descending order, and then we return our sorted data frame. And this is the result. As you can see, we sorted by highest population down to the lowest and showed total deaths and death rate from there.
For insight 3, we looked at, is there a major correlation between a country's amount of tests given and deaths per million for people in 2021? Is the peak of COVID-19. Does more frequent testing result in better chances of survival? So firstly, we read the Excel, then we pulled out country tests, the country, the tests, and the deaths per million. We isolated by the year 2021, and then we created a new column called death to test ratio through the division of the two different information by dividing deaths by tests. And then we indexed by year, we sorted the tests per million to get the highest and then the lowest, and then we returned the data frame. You can see the data here where it's sorted by test per million from lowest to highest, and then it shows the countries with high death to test ratio and the countries with low death to test ratio.
Insight number 4 goes for the question, does a country's percent of healthcare coverage have any connection to the total number of people recovered from COVID-19 in different countries around the world? So as a result, we pulled country list from earlier CSV, iterated through the list to strip the percentage, place it in data frame within the year 2021, read the Excel, pulled the country and total recover, and then we merged two sets of data on the country, dropped all NANs, sorted by healthcare coverage, and then we returned our sorted data frame. And as you can see here, we are sorting by healthcare coverage and it's ascending, and we're trying to look at the relationship between how many people are covered and how many people recovered as a result from being covered by healthcare.
For insight 5, we looked at all continents to see if any continents were significantly better at limiting cases of COVID-19, and does the total population of these continents have an effect in this? So at first we read the Excel file and then grouped the continents by the continent they are in, or group countries by the continent they are in, and we calculated the sum of active cases and population. Then we selected only data from 2021, and we returned the group data by continent for 2021. Actually, so you can see the output at the bottom there with each different continent, their active cases, and their population of the countries that we had available.
And this is our data visualization number 1. So we created a pie chart. Our first one that we created was active COVID-19 cases by continent, and we wanted to show the proportions within each country. So as you can see, North America is almost 50% of the world in active COVID-19 cases, as well as, but there's a difference as we want to show the population as well, that Africa has a higher proportion compared to North America in COVID-19 cases, despite North America having way more COVID-19 cases, even though they are smaller in proportion in population by continent.
As data visualization 2, this shows a chart of the total recovered per 100,000 people, and then also the country and their healthcare coverage. So the blue line shows the healthcare coverage percent, and then the orange line shows the total recovered per country. And we wanted to show that as total healthcare coverage goes up, total recovered also has a slight incline up. From this graph, you can see that at the beginning, countries that have very little healthcare coverage also have very little total recovered. And with countries that have high healthcare coverage, there's a much higher chance of having a really strong total recovered number rather than a one near the zeros.
And this is our data visualization number 3, and we wanted to show it in a scatter plot. As you can see that countries with less tests are their countries that administer less tests per million are gonna result in more deaths per million, but there are exceptions such as outliers such as Turks and Caicos with more tests per million, leading to less deaths and less tests in countries such as Egypt and the Dominican Republic that result in less deaths per million.
Some overall conclusions that we had were that women outlive men to 65 years old in 2021 in most scenarios, but it's a much more significant difference at lower survival levels for countries such as Lesotho compared to Monaco and other major countries.
And this can be shown as Monaco being notoriously known for being a wealthy country. We can see that they have more infrastructure to support men and women in surviving COVID-19 as a result of being more wealthy. And as well as there's a small but apparent correlation between population size of a country and their 2021 death rates, as a country with a larger population size has a harder time controlling their spread of COVID, which results in a higher death rate.
Yeah, this can be seen in countries like the US and especially Bulgaria, where Bulgaria has a really, really, really high death rate compared to most other countries. And they have a pretty decent sized population, while countries like Greenland have a really small death rate, but also have a way easier time of controlling their population. Another conclusion we had was the amount of tests directly correlates with the amount of COVID-19 active cases in the country in most scenario. More tests just lead to less active cases because you can catch it earlier. As you saw in that last graph, or one of the last graphs, as tests go up, active cases tend to stay near the bottom, especially in major countries that are able to administer lots of tests, but would also have large numbers of active cases.
And universal healthcare and those that tend to have that are closer to 100% in providing for the population have higher recovery rates than countries lacking significant healthcare. And we can see this as countries that provide everyone are able to attend to everyone's needs that need treatment. And so as a result, people are able to recover and are less likely to become sick.
And then lastly, some continents were far more effective at treating and limiting the virus than others were. This can be seen as Asia and the US and North America were two of the worst, as their percent of COVID-19 cases in the country was significantly greater than the percent of population they take over from the countries that we were able to identify. While a country like Europe was pretty much exactly in line with their population to the amount of active cases they had. Which shows that the healthcare systems in Europe were pretty strong in limiting the effects of COVID-19, despite it still being a pretty close together community like North America and Asia would be.
So some things that we learned from this project were that we were able to solidify our knowledge about pandas, NumPy, and Beautiful Soup library as we parsed through websites and HTML with Beautiful Soup, creating data frames with pandas, as well as we gain greater knowledge in creating data visualization and graphs using Matplotlib, as we were able to show correlations and proportions within these graphs. And we hope to, as a result of this project, apply the knowledge that we have with these Python libraries to future classes and as we start to apply for internships and work for these large corporations. And as a result of using these, we've gained greater confidence in how to use them. Some challenges that we faced during this project were our downloaded data set was a very large file, and the file had a lot of a significant amount of empty rows to clear and sort through. So it's hard to determine what factors that we wanted to include in our data set, but also we wanted to make sure we weren't eliminating everything that could contribute to our conclusion. Yeah. Thank you.
That's it. Thank you.